So thank you so much, Anita, for joining me today for this conversation to discuss about the importance of bladder cancer and bladder cancer affecting women specifically and what it means. So I'd like to get us started with perhaps an introduction from you. If you could just share briefly your story and also the organization that you represent.
My name is Anita Eik Roald, and I'm the CEO in the Norwegian Bladder Cancer Society. And I've had metastatic bladder cancer the last 5 years, but I'm still here thanks to immunotherapy that I got 3 years ago now.
And what advice would you give to female patients facing bladder cancer today?
I would say, first of all, that blood in urine, that is not a normal condition. So if it's not from a urinary tract infection or other more obvious conditions, it must be examined more closely by an urologist. It's not enough to run to the doctor again and again for more antibiotica.
And what advice would you give to family members or friends or carers in general to help them better care for, let's say, women recovering after surgery or women undergoing treatment as well? What advice would you give to them?
I think most of all, it's to be patient. It will take a long time to recover from such a large operation, both physically and mentally. But I also believe it's quite individual. Myself, I needed a long time to find a kind of order in the chaos before I wanted to talk to others about my inner thoughts and my fears. So I had my closest and my family, but it was hard to talk with others outside the inner sphere for a while. And then, it will come if you are patient enough.
What are the biggest challenges that women affected by bladder cancer face in general? And is there something that you can share from your personal experience or from meeting other women affected by bladder cancer? And is there anything also that perhaps your organization in Norway is doing to support them in this?
In my situation, I didn't know much about bladder cancer when I got it. So I was surprised, and I was even more surprised when they told me that I had metastasis and it was not much they could do to save my life. So I was overwhelmed, of course, and shocked. And I also have heard, and I felt maybe a little bit of it myself, I felt a little bit shamed about having suffered a disease that primarily affects older men. I couldn't believe it, and I was, yes, it was kind of weird, if I can say. So we have, in Norway, we have in our organization a women group, especially for that we will now see what we can do about this stigma in the future, and see what we can, if it helps just to talk about it, or if we need to do something more about it.
So if you could suggest one thing, it's a straightforward question, but a challenging one, I know. If you could suggest one thing that patient groups, as the World Bladder Cancer Patient Coalition or Norwegian Bladder Cancer Patient Society, and the healthcare community together could do to tackle some of these challenges facing women with bladder cancer and help ensure also better outcomes for them. So if you had to pick just one thing, what could that be?
I think that since early detection is one of the most important things for the outcome, more women and doctors need to have bladder cancer in mind. Also, when younger women meets the doctor with blood in urine. And therefore, I believe that to give and spread information about early symptoms and the fact that 1/3 of all the patients are women is one of the most important things that we can do.
Thank you so much, Anita, for joining me today and for sharing your personal experience and thoughts. And I'm sure this will also help any women that might be watching this video facing bladder cancer today to learn more about it. And I'm sure that together as a community, as a World Bladder Cancer Patient Coalition and broader healthcare community, we can work together and help, raise that awareness about bladder cancer, support these women facing bladder cancer, and ensure that early diagnosis is the one of the biggest focuses that we can help improve women's outcomes with bladder cancer. So thank you so much, Anita, for joining me today.